Thank you for your interest in the Vibrant Wellness Wheat Zoomer. This video is designed to help you quickly interpret a Wheat Zoomer lab report. Look for further follow-up videos that will go further in depth into the individual panels on the Wheat Zoomer for more advanced interpretation. The Vibrant Wheat Zoomer is not just a test that looks at gluten sensitivity. There are actually 6 sections of the test that take a more thorough look at wheat, gluten, and intestinal permeability, and this test will help you make more informed clinical decisions about your patient's treatments. Before interpreting the test, first clarify the fasting status of the patient at the time of the draw. This may affect the clinical utility of the marker zonulin. Clarify whether your patient was gluten-free. Was it 100% gluten-free or kind of trying to be gluten-free? For what length of time was the patient gluten-free before testing? If not gluten-free, how frequently does the patient consume gluten-containing foods? A food diary or nutritional recall may be highly useful to clinicians for the interpretation of the Wheat Zoomer. Before diving into the individual panels, it's important to get a basic understanding of the patterns of immunoglobulins and what each type can indicate for clinical interpretation. IgA immunoglobulins are a mucosal immunoglobulin found primarily in the epithelial linings of the body, the intestinal tract, lungs, esophagus, blood-brain barrier, and around the intestinal organs, for instance. IgA antibodies are a first-line defense, and elevation of these indicates a recent exposure in a mucosal tissue. These are more accurate than IgG antibodies, and on a blood test of this nature usually indicate origination in the intestinal tract. IgG immunoglobulins are the most numerous in the body, found in the blood, and are considered systemic and nonspecific to any one location. Not all IgG antibody elevations indicate a sensitivity. Some can simply be an indication that an antigen has leaked into the blood and the immune system has tagged the antigen as non-self. IgG antibodies alone are usually not as diagnostic as IgG and IgA, but in the absence of a strong enough IgA response, IgG antibodies may be more relevant. Elevated IgG antibodies without concurrent IgA antibodies might also indicate the residual antibodies to an antigen that have not yet fully cleared out of the bloodstream after discontinuing exposure to the antigen. This might be the case when a patient has gone gluten-free recently before taking the Wheat Zoomer test and no longer has IgA antibodies to gliadin, for instance, as there has not been a recent mucosal exposure to it, but still has some residual IgG antibodies to gliadin from the last exposure to the antigen several weeks ago. Starting with the celiac panel. Celiac disease is a growing autoimmune disease with around 1% of the population affected. Data shows that 1 in 7 Americans has a reaction to some kind to wheat or a wheat or gluten-related disorder. The Vibrant Celiac Panel is able to detect celiac antibodies with 99% sensitivity and 100% specificity. Perhaps the most important qualifier for the rest of the test are the total IgA and total IgG measurements. These measure the total IgA and IgG that the individual is able to produce and indicate whether the rest of the IgA and IgG values on the report will be accurate indicators of reactivity. Despite the reference range given, most providers find that the actual lower control limit should be cut off somewhere around 160 for IgA, as that is the bottom third of data values. A low or deficient total IgA does not mean the patient has celiac, but it can be a risk factor for celiac. In this example, the patient has an actual deficient IgG and a subclinically low IgA, which means that these immunoglobulin values throughout the report may actually be lower due to the inability to produce an adequate response to the antigen tested. Tissue transglutaminase 2 is the traditional biomarker used to evaluate the presence of celiac disease, and deamidated gliadin peptide is also a traditional biomarker that can indicate celiac disease. One needs not have both markers elevated in order to have celiac disease. It is important to know that there are some cases where tissue transglutaminase 2 will be elevated in the presence of another autoimmune disease, so it is important to correlate physical symptoms with lab values. The intestinal permeability panel is one of the most useful panels on the entire report. It is important first to understand that this panel is independent of gluten or wheat consumption. If an individual has intestinal permeability, it will not matter if they are gluten-free at the time of their blood draw. The first marker on the report is zonulin. Zonulin is a protein complex in the intestinal tight junctions. It acts as a gatekeeper that controls the flow of nutrients and molecules across the membrane. Zonulin is increased in the presence of gluten consumption, as well as in the presence of high-fat meals, and in the presence of bacterial endotoxins, such as lipopolysaccharide, which we'll get to in a minute. F-actin is specific to the intestinal smooth muscle and is distinctly different from actin found elsewhere in the human body. Actin is part of the actomyosin protein complex. Vibrant is able to isolate just F-actin in order to get a more accurate picture of immune response in the intestinal membrane. Antibodies to actin can identify the degree to which intestinal destruction is occurring, but can also be indicators of autoimmune diseases such as connective tissue disease as well as autoimmune hepatitis. Actin elevated alongside LPS can indicate that permeability is occurring transcellularly, meaning through the intestinal cells instead of just through the tight junctions. Lipopolysaccharide is an endotoxin produced by gram-negative enterobacteria. As an endotoxin, it is a very potent mediator of systemic inflammation in the human body. LPS-IgA is a more exact and acute measure of LPS of intestinal origin. On the Wheat-Zoomer, LPS is a general indicator of dysbiosis-mediated leaky gut and should lead the practitioner to draw additional clinical labs such as cardiovascular markers, inflammatory markers, diabetes and insulin resistance markers, as well as consider that other systemic inflammatory symptoms may be related to the presence of LPS in the bloodstream. Another recommendation when LPS antibodies are elevated is to run a Vibrant Gut Zoomer in order to clarify the source and nature of the dysbiosis. The tissue transglutaminase deaminated gliadin peptide fusion peptide is a brand new marker that Vibrant has added to the Wheat-Zoomer. It is called a fusion peptide because it is comprised of DGP cross-linked to TTG. The Vibrant Advantage provides us with the ability to look at the most linked cross-link combinations of this fusion peptide, currently over 100 combinations. This biomarker allows for an earlier window of celiac disease initiation and diagnosis and could identify that progression anywhere from 14 months to 4 years earlier than traditional laboratory markers. There is currently a pending publication from Vibrant on this biomarker as also being an indicator of the healing status of celiac disease. The differential transglutaminase panel is perhaps one of the most illuminating panels for many patients because it can detect autoimmune reactions to gluten that are not celiac or have not yet become celiac. Gluten is still the trigger for these autoimmune reactions, but they manifest symptomatically differently than autoimmunity in traditional celiac disease. Transglutaminase 3 is correlated with skin manifestations of autoimmunity such as dermatitis herpetiformis, eczema, and psoriasis. And transglutaminase 6 is correlated with neurological manifestations of autoimmunity in the cerebellum, such as gluten ataxia, gait abnormalities, balance, and coordination problems. To quickly recap what we've discussed on the first page, the three main takeaways here are celiac disease, intestinal permeability, or leaky gut, and gluten-mediated autoimmunity. These are going to relate more systemically to other clinical diagnostic labs such as cardiovascular, inflammation, diabetes, thyroid, neurological, integumentary, autoimmunity, and circulatory health. Consider running additional labs to examine whether further specific or targeted therapies are warranted. Moving on to page 2, we come to wheat germ agglutinin. Wheat germ agglutinin is the lectin component of wheat and is distinctly separate from gluten or other non-gluten wheat proteins. There may be some connection with wheat germ agglutinin reactivity and reactivity to other dietary lectins, but this connection is less clear and further research needs to be conducted. Not all individuals that react to wheat germ agglutinin will need to follow a low lectin diet. Wheat germ agglutinin antibodies can also indicate that an individual may have low levels of vitamin D due to interference with transcription at the cellular level. Testing vitamin D levels alongside the Wheat-Zoomer is recommended. Wheat germ agglutinin can also be commonly used in supplements as an additive, and these supplements may still be labeled as gluten-free due to the different protein structure of wheat germ agglutinin. Gliadin is one protein in the gluten protein complex. Most people that react to gluten are reacting to the gliadin portion of it. Gliadin is also the protein portion of gluten that binds to tissue transglutaminase 2 in celiac disease progression, as well as the one that binds to zonulin to precipitate leaky gut. The gliadin panel is testing reactivity to all 4 isoforms of gliadin, and it does not matter which one the patient is reactive to. Any reactivity on this panel indicates a gluten sensitivity. Gluteomorphins are the peptides found in wheat that react with opioid receptors on the brain. Individuals with antibodies to gluteomorphins may experience more of a high or euphoria when consuming gluten-containing foods, and they may also experience a tougher time eliminating this food from their diet, or what might be called withdrawal from gluten, due to this heightened psychological response to gluten. Proteonorphin antibodies can be an indicator of a gluten-induced reaction that targets the signaling hormone. It may interfere with mood or other functions of protein in the body. Wheat IgE is a mast cell-mediated true allergen antibody. It is rare to see elevated wheat IgE on a wheat zoomer, as these individuals typically know they have a wheat allergy, usually from a young age, and are not already consuming wheat. Therefore, usually a gluten sensitivity is not suspected. However, the leaky gut panel is still clinically relevant in these individuals should you choose to draw it, as they may have leaky gut and they may still be consuming gluten in the form of barley or rye. Wheat germ allergen IgE does not usually decrease when wheat is eliminated. IgE antibodies remain elevated long-term after initial allergic response is established. Glutenin is the other part of the gluten superprotein complex. While less common, some individuals do show reactivity to glutenin, either without concurrent gliadin reactivity or accompanying it. This panel allows Vibrant to look at the full spectrum of reactivity to glutenin from high to low molecular weight. There's no clinical difference in outcomes between antibodies to high molecular weight and low molecular weight glutenin. Any elevated antibody to this protein still indicates a gluten sensitivity. Part of the Vibrant advantage is the unique non-gluten wheat panel that is only found on the Vibrant Wheat Zoomer. This panel is testing reactivity to proteins in wheat unrelated to gluten, but still clinically relevant to immune reactions. It makes up 30% of the protein molecular weight of wheat. Some individuals are more reactive to wheat proteins than gluten itself, and any reactivity on this panel indicates a sensitivity to wheat. Reactivity on this panel requires an extra layer of clinical education because certain foods can be labeled gluten-free but may still contain wheat starch as a filler, which may contain these non-gluten wheat proteins. If a patient is going gluten-free, they are going wheat-free by default, but may need to be very cautious about packaged foods due to labeling loopholes. The previous two pages have looked more specifically at individual protein reactivity rather than broad disease implications. These panels should be looked at first in reference to an individual's reactions to specific proteins in wheat and/or gluten. The clinical recommendations will not change dramatically if there's reactivity on one or many panels, but the thoroughness of the markers is necessary to both determine an accurate picture of a patient's reactivity to the proteins in question, as well as to differentiate between specific protein reactions. To tie together the major points from this presentation, look at the entire report before diving into one particular panel. A holistic picture of the patient's reactivity is painted throughout the report. The frequency, recency, and amount of gluten consumption is relevant to the test results. A patient that is truly 100% gluten-free will have little or no reactivity on this report, whereas a patient that is kind of gluten-free but still consumes it occasionally will display more reactivity. A patient that is reactive to gluten but consumes it often will display even more reactivity still. Other clinical labs will be critical to making the best diagnoses and developing the most thorough and comprehensive treatment plans for your patients. The Wheat Zoomer is merely a starting point to discover the origins of disease in the gut. Many of your questions about more detailed information can be found in the materials after the lab panels in the Wheat Zoomer. There is a simple and patient-friendly gluten-free handout that helps individuals get started on going gluten-free. There is also a glossary that you can refer to if you need a bit more clinical understanding of some of the terminology on the report. And finally, there are selected references at the end of the report that you can read at your leisure to better understand the clinical utility and implications of the biomarkers on the Wheat Zoomer. Here we have a sample report of a patient that we'll briefly walk through just a couple minutes to derive a working idea of how reactive this patient is and what to do for them. The first thing I gathered from this patient was his dietary history as it relates to gluten. He was consuming it daily, several times a day at the time of the blood draw. Next, we note that his total IgA is nice and normal, so we can trust the IgA values on this report as being accurate. Nothing significant shows up on the celiac panel, except that his IgG tissue transglutaminase 2 is very close to the upper control limit, which is much higher than we should expect if there was no progression towards celiac. Next, his intestinal permeability panel is significant for paracellular permeability, or permeability at the tight junctions, as we would expect to see in someone with a history of celiac. These next couple of panels will walk through wheat germ agglutinin and gliadin. It's not hard to deduct from this that this gentleman has a strong reaction to both wheat germ and gliadin. The recommendation based on this would obviously be to go gluten-free. These next two panels are really just further evidence that this patient reacts strongly to wheat and gluten. It's interesting that he has an actual wheat allergy and did not know it. However, it was not clear from his description and recall if the celiac diagnosis in infancy was actually celiac or if it was a wheat allergy diagnosis. The reactivity to glutenin and gluteomorphins are just further indicators that he is sensitive to numerous parts of wheat or gluten. And last, probably the most telling, is a strong reaction to the non-gluten wheat proteins alongside the differential transglutaminase panel. This individual already having a diagnosed history of seizure displaying gluten-mediated autoantibodies that manifest neurologically and in the integumentary system is a serious indication that his gluten consumption and resulting leaky gut have precipitated chronic inflammatory conditions. Bottom line for him is that he needs a leaky gut protocol that will focus on nutritional as well as supplemental interventions to heal and seal the gut with full gluten elimination lifelong. We want to thank you for your time and interest in Vibrant Wellness Testing.